my name is Mariah. I'm a student respiratory therapist at Baptist University of Health Science. Today I'll be doing event circuit change. Two indications for event circuit change would be to if the patient is having a post-op operation, then you will want to change out the circuit from the operation circuit to a new circuit. If the patient has changed precautions, meaning if they were in airborne precaution or contact or droplet precaution and they're now no longer in those precautions, you would want to get them on the vent circuit. Contraindications for a vent circuit change would be increased FiO2, but then you want to minimize the amount of time that the patient doing their vent circuit change, the patient has limited O2. Increase heat, and also for the patient becoming hemodynamically unstable, meaning the patient can become tachycardic or bradycardic. So complications of a vent circuit change would be tension on the tube, displaced ET tube with tracheostomy tube. With that, you want to decrease the amount of tension that you have on your endotracheal tube or your tracheostomy tube. And another complication would be if the patient is hypoxemic, you want to decrease the amount of time the patient is without oxygen. So my equipment is my Fisher tracheal heater, my alcohol wipes, my filter, the corrugated tube, my vent circuit with my inspiratory limb with the temperature probe and my expiratory limb, and I have my ballot. And I also have my bag valve mask that's hooked up to my flow meter. Okay, so this is Mr. Jones. Hi, Mr. Jones. My name is Mariah Mason. I'm a student respiratory therapist. I'm going to suction you to clear out your airways because today we're going to do a vent circuit change. Alright, so I suction my patient and I hyperoxygenated him for 2 minutes. I tell my patient that we will be doing a vent circuit change today. And the vent circuit change will take approximately 10 minutes, maybe less. With that, I'm gonna make a few disconnects and reconnects. So, okay, so first I'll make sure that my heater is turned off. My heater is turned off, and then I'm gonna bypass my heater. And with that, I'm gonna take out my filter that has the tube attached to it and replace it with my inspiratory limb. The limb with the temperature probe that's attached to it and connected to my inlet. Okay, so first, I'm gonna make sure that my heater is turned off. And I'm gonna bypass my heater by taking out my filter that's attached to the tuber and replace it with my inspiratory lamp. But before I do that, I'll detach my cords. Okay, so I make sure I turn off my heater. I want to bypass my heater by replacing my inspiratory lamp with my filter that's attached to my tubing. But first, I'm gonna make sure that all my fluids are detached so that it'll be a smoother transition for me. And my water bag is detached from my heater. I don't have another water bag, so it's just gonna simulate that this will be a new one. So now that that is detached, I'm gonna bypass my heater. And then we can remove the heater. That will go in the trash. I will place my new heater. Picture pastel. Use my alcohol wipes to wipe down my temperature probe. And with my other fluids. I attach my tubing to my filter. And I just let that hang out right there. Then I want to set up for getting ready to change out my circuit.
Okay, you too, I see.
So I'll attach my ballard. To my new circuit. So when I get ready to change out, it'll be a smooth transition. Attach my inspiratory lamp, which is my blue lamp, to my heater. And I'll have my accessory lamp attached to my filter. So when it's time to change it out, smooth transition. We want to minimize the amount of time the patient is not being ventilated as much as possible. So whatever we can attach and detach, we should go ahead and do that beforehand. Makes it a much smoother transition. So I'm gonna let my patient know. Mr. Jones, we're gonna make the quick disconnects and reconnects. Beforehand, I want to hyperoxygenate my patient. My patient is hyperoxygenated, and we're gonna make the disconnects. We're gonna do filter patient filter. I look at my ventilator, make sure my patient is being ventilated. Begin removing all of the old tubing. Put that away. And then I check my equipment, make sure everything is tight and connected.
This video was provided by the Respiratory Care Department at Baptist University of Health Sciences. And I would like to give a special thank you to the program director and the clinical director, Ms. Anderson and Ms. Beckley, for allowing time for this video to be produced. Thank you.